Hello there, my name is Niveen Abdu. I'm a master's student for Walden University. I came to Florida about 10 years ago. In my first job, I was introduced to my first HIV patient. He was one of my coworkers, and I wasn't really surprised, but I was wondering like what's going on with him, like how he deal with his disease, how he worked with it, how he lived with it. Is it being accepted in the community? Does he have the right of treatment? Does he's able to afford the treatment? And all of these questions has been circling in my mind, which make me do the search of trying to understand the disease and what's going on around it. It happened to be that Florida will be the second state in the count of patients that having HIV positive, with a rate of like almost 5,000 patients per 100,000 patients in the population. So that is a big number. Not also to mention that there's some areas that doesn't have the access to the healthcare system. It's underserved areas, and they are not really they haven't been tested, they haven't been even observed by a healthcare provider to begin with. So the numbers might be more than just 5,000 cases. In our marketing plan, the main idea is to know who's our customers, why we need to target them, why we need to understand their needs, how to make them live in a blame-free environment, and how to normalize the idea of the HIV testing to begin with, and how to add this HIV testing in the routine visits with the healthcare provider for the people that have a high risk behavior. One of the idea of the marketing plan is the social media. The social media reach out for millions of people every year, and it would be really easy to normalize the idea through the social media, because like you will be everyone will be reading about the HIV, everyone will be understanding that it's not such a risky disease. There's a good chance even if you get infected with the HIV, you're not going to be transmitting the disease if you treat it. With the treatment plan, you might live just as a normal patient, that maybe have a cardiac problem or something. He'll be living just as normal and having a normal sexual life as well, because that's a main concern for those patients. Normalizing the idea of the testing will make everyone feeling comfortable of let's know what's going on, let's get treated, like it's okay. And this will be happening through increasing the number of the community health centers, to like make the healthcare available for every patient, even in the suboptimal areas where there is no actual care that provided over there. Reaching out for patients, having increasing the technological also impact, where like self-testing, just like what we have for the COVID testing. It's a home testing that the patient can take at home and test themselves and gain the confidence in themselves in case if they have the fear from the community itself. Also setting a treatment plan and working with the patient in their social, culture, and behavior aspects will improve. This marketing plan will improve, like increasing the rate of testing, and also the word of mouth between the patients will make them more confident of, okay, let's get tested and let's get treated, it's okay. The community health centers as well will help in having not only normalizing the testing, but also normalizing the psychological aspects of this disease, because the patient might be depressed, might be feeling ashamed. Treating the patient as a whole, having them confident about themselves, about the treatment plan, and about the whole testing will improve the rate, which will decrease the rate of infection and decrease the transmission rate, as well as maybe like in 5 years, through like education and knowledge and information, will have reduction in the HIV cases itself. And that would be the main target for this marketing plan. Thank you so much for listening.